when do you think FHIR will be used by average U.S. hospitals? What are the typical workflow? What are the typical workflows that will be supported, and will FHIR replace V2?
Great question. I think the key part of that, insightful, is to say, you know, we're U.S.-centric. HL7 is an international standard, so there is a long answer to when will FHIR take off in various venues. I think the Argonaut project is pushing hard enough and fast enough that we're going to see the use of FHIR in the context of smart apps this summer. And I think that will begin with probably read-only access, primarily those types of smart apps I showed, be it a growth chart or be it a heart disease risk profile kind of environment, and then moving up to more complex examples like one of the applications that's going to probably be one of the first that has read-write access to Cerner. I think it was a rheumatology application that allows a patient to track through the web, right? Track their pain and in various joints, and then to feed that information in a caregiver-centric way back into the EMR. So that means that, for example, a picture or a PDF can be produced, and that resource can be published back into Cerner. And that's really, again, back to all of the authentication questions. The beginnings of this are a caregiver has already authenticated and already has a patient, and we're trying to pull information in to augment the data that I already have, or to view the information that I already have in another way. The next phase of this is inside the four walls of my hospital. I want to leverage that source of truth, that data that's sitting in my EMR or in my lab system or in my radiology system. That's the source of truth. Allow me to query it on my own schedule, on my own workflow, rather than a predestined workflow from an HL7 V2 perspective, and allow a vendor to produce a capabilities-based interface, right? These are the things that I allow you to do with my application, right? So we looked at an example of, you know, this is Epic's example, right? These are the query parameters that I'm able to do that let me do a particular type of search for a patient, right? So this is a capability statement that says, here's the version of FHIR and the capabilities that Epic supports. How you use this, right? How you use the results that come back are not predestined. That's the cool part of FHIR. And I see this beginning, you can imagine, right? If you have a version of Epic or a version of Cerner, even if all you have is the very basic resources that are described here, even just being able to say, would it be helpful to get a list of the current medications and prescriptions that a patient has at any time, right? And those prescriptions and medications are sitting in Epic, and rather than having to log into Epic, you authenticate and you're able to use that data however you see fit within your own four walls. I think that next phase is coming in the next 2 to 3 years, where given a very basic, whether it's Project Argonaut style data access framework or whether it's something more complex, I think in the next 2 to 3 years we're going to see the beginnings of simple applications that are able to read and write to the Epic and Cerner databases of the world. And I think 5 years out, we'll have solved the authentication questions that were being raised, and we'll have more access remotely. But clearly we have to solve the governance problems. We're trying to crawl and walk before we run in terms of the FHIR specification. So great question. I appreciate that.